Hello, my name is Baraka Nanyaro, and today I'll be presenting on human immunodeficiency virus, commonly known as HIV. I'll cover the classification and structure of HIV, its transmission, disease features, diagnosis, treatment and vaccines, new data, and takeaways. For the classification and structure, HIV is part of the Retroviridae family and belongs to the lentivirus genus. It is an enveloped virus with a spherical shape, measuring about 100 to 120 nanometers. Inside, we find two single-stranded RNA molecules and three important enzymes, which include the reverse transcriptase, integrase, and protease. These enzymes are critical because they allow the virus to copy its RNA into DNA and insert it into human cells. The viral surface proteins, which are GP120 and GP41, are like the keys that let HIV enter CD4 T cells. Coming to the HIV/AIDS life cycle, it explains why this virus is both persistent and difficult to cure. Infection begins when GP120 binds to CD4 receptors and co-receptors on the host cell. GP41 then helps the virus fuse with the cell membrane. Once inside, reverse transcriptase makes DNA from the viral RNA, which inserts into the host genome. From there, the host cell is hijacked to make viral proteins that assemble into new virions. These particles bud off and continue the cycle. Disease features. HIV disease progresses through three main stages. The first is acute infection, about 2 to 4 weeks after exposure. Symptoms often occur, which may include flu, fever, sore throat, or rash. But during this time, the viral load is extremely high. The second stage is chronic latency, which can last several years. People may feel healthy, but HIV silently reduces CD4 T cell counts. The last stage is AIDS, or acquired immunodeficiency syndrome. This occurs when CD4 counts falls below 200 cells per microliter, leaving the body vulnerable to opportunistic infections like tuberculosis, pneumonia, and fungal infections, and cancers such as Kaposi sarcoma. Global burden. HIV continues to be a major global health challenge. As of 2022, data showed that around 39 million people worldwide are living with HIV, and approximately 630,000 people died of HIV-related illness on the same year. In particular, Sub-Saharan Africa bears the greatest burden of HIV, accounting for nearly 2/3 of the global cases. However, certain groups are at higher risks, and these include men who have sex with men, people who use drugs and inject them and use needles for injection. We have sex workers and those with limited access to health care. Transmission. HIV transmission occurs through the exchange of specific body fluids, which may include blood, semen, vaginal and rectal secretions, and also breast milk. The main routes include unprotected sexual contact, sharing needles, transfusion with unscreened blood, and mother-to-child transmission during pregnancy, birth, or breastfeeding. However, HIV is not spread through casual contacts like hugging or sharing food. Therefore, prevention is crucial and includes mostly use of condoms exchange programs on how to use sterile needles, routine blood screening, and the use of PrEP, commonly known as short form for pre-exposure prophylaxis, and that is for those who are at high risk of the disease. Therapy. Treatment for HIV relies on lifelong use of antiretroviral therapy, or ART. These drugs target different stages of the viral life cycle. For example, the reverse transcriptase inhibitors stop the virus from copying RNA into DNA. Integrase inhibitors prevent integration into the host genome, and protease inhibitors block the final assembly of viral proteins. Taken together, these drugs suppress HIV to undetectable levels in the blood. They also prevent transmission, a concept known as undetectable and transmittable. However, there is still no cure, and challenges such as side effects and treatment non-adherence are still persistent. Testing and diagnosis. HIV is diagnosed through laboratory testing. Today, most healthcare settings use fourth-generation tests which look for both HIV antibodies and the P24 antigen, thus allowing detection early than the older methods. If the initial test is positive, confirmatory tests such as the Western blot or the nucleic acid test are performed. The NATs can directly detect viral RNA. The window period usually ranges from 10 to 33 days. However, early diagnosis is critical because it allows individuals to begin ART immediately, thus lowering the risk of disease progression and reducing the chances of transmitting HIV. New research and future directions. Research into HIV treatment and preventions continue to evolve. One exciting area involves broadly neutralizing antibodies, which can target many different strains of HIV and may help in developing vaccines. Another advancement is long-acting injectable ART, which can be given every 1 to 3 months instead of daily pills. Experimental approaches like CRI, SPR gene editing, and stem cell transplants have even shown effectiveness in rare cases. The ultimate goal is to reduce global burden and eventually achieve eradication. Thank you.